Imagine walking down the street, completely unaware that your life could change in an instant. That's the chilling reality of cardiac arrest, as Chris Worwood discovered at just 40 years old. But here's where it gets groundbreaking. Genetic testing is emerging as a potential game-changer in understanding and preventing such life-threatening events. What if a simple test could predict and prevent a cardiac arrest before it happens? Chris, now 54 and living in Balham, still undergoes regular checkups at St. Thomas's Hospital, including genetic tests as part of his ongoing care. If you can find something in your genetics that identifies the risk before it's too late, that's a game changer, he reflects. His experience highlights the transformative potential of genomics in healthcare. And this is the part most people miss. Genetic testing isn't just about diagnosing after the fact. It's about predicting and preventing. As part of the UK government's 10-year health plan, a new genomics population health service is being rolled out across England. Nurses are being trained as genomics champions to help patients access faster diagnoses and life-saving treatments closer to home. This initiative aims to tackle conditions like cancer, heart diseases, and rare genetic disorders that often go undetected for years. But here's where it gets controversial. While genetic testing offers immense promise, it also raises ethical questions. Should everyone undergo genomic testing, or should it be reserved for those with clear risk factors? And what about the psychological impact of knowing you carry a potentially life-threatening gene? These are questions that spark debate and demand thoughtful discussion. Dr. Teofila Buser, from Guy's and St. Thomas's NHS Foundation Trust, emphasizes the importance of genetic testing in making sense of complex symptoms. It helps us get to a diagnosis and ensure the patient receives the right treatment, she explains. Catherine Renwick, a nurse consultant at the same trust, adds, predicting disease early and providing timely treatment will reduce the long-term burden on the NHS, something we urgently need. For Chris, genetic testing has already made a difference. He now has a defibrillator implanted in his chest and will be monitored for life. Thanks to the insights gained from his genetic profile, but his journey isn't over. He still needs more tests to pinpoint the exact cause of his cardiac arrest. Prof. Brian Williams from the British Heart Foundation, BHF, highlights the deadly potential of undetected inherited heart conditions. BHF research has identified some of the faulty genes responsible, but there's more work to do to prevent future tragedies, he says. The government's push to expand genetic testing at a population level is a step in the right direction, bringing cutting-edge science into everyday clinical care. Health Minister Stephen Kinnock sees this as an opportunity not just for patients, but also for healthcare professionals. We're creating fulfilling careers that recognize and utilize nurses' invaluable expertise, he notes. Prof. Dame Sue Hill adds that this initiative will enable more people to access genomic testing for risk prediction, prevention, and addressing undiagnosed conditions. So here's the question for you. Do you think widespread genetic testing is the future of healthcare? Or does it raise more concerns than it solves? Let's hear your thoughts in the comments. This is a conversation we all need to be part of.